Well, Dr. Danielle Jones, also known on social media as Mama Dr. Jones, is an American obstetrician and gynecologist based in Austin, Texas. Thanks so much for coming on the program.
Thank you for having me. So
we heard those really tough stories there of mothers being separated from their babies, and it's a really difficult issue to think about, but it's something that's really important. We focus here on the UK figures. This is where it's come from. Is this something that you recognise where you are?
Absolutely. Those stories are all too real for me. I've seen this in my own patients time and time again, and it seems so much worse right now with the Delta variant than it had been at earlier points in the pandemic. Those are stories that we're seeing everywhere.
Why do you think this is? Is this hesitancy to get the vaccine, a hangover from just us not having enough information at the beginning of the pandemic? What's going on?
You know, I would never fault a mother for being worried about getting the vaccine. There's been so much misinformation out there. Pandemic medicine is scary, and everybody just wants to do the best thing for themselves and their baby. But at this point, we do know that the vaccines are safe in pregnancy, that they protect against these very scary, very severe outcomes that pregnant people are more likely to have, and that they are not associated with any increased risk to the pregnancy or to the baby.
And just more widely away from mums-to-be, there is a generally quite high level relative of vaccine hesitancy in Texas.
Yes, we are experiencing higher than average levels of hesitancy, and I think people are confused. There's a lot of things going around that may not be able to be kind of teased out to see what is true, but the truth is that we now have a lot of science on this, and data indicates that it is both effective and safe for pregnant people, but for the general population as well. So if there's one message I could get out to people, it would be to please get vaccinated.
I'm just going back to the specific issues with new mothers in hospital. What are some of the complications we see? We know from the data that they require, that they're the most seriously ill in hospital, require most serious treatment. What does that mean?
Yeah, so what we're seeing is that about 50% of people who are pregnant and get the Delta variant who become symptomatic will have moderate to severe symptoms. And out of those who have to be hospitalized, about 1 in 7 will end up in the intensive care unit. In the intensive care unit, you're at an increased risk for being put on a ventilator, for being transferred for ECMO, which is the artificial lung that they were talking about, basically a last-ditch effort to let your lungs and your heart rest and let a machine do all of that work for you. All of these things are risks to the person who is pregnant, but we also see an increased risk of severe preterm delivery, like she was discussing with her preterm twins, and like Claire had discussed in the segment before. And these are things I'm seeing as well, things that we're seeing in the data as it comes out. These are very real risks, and they're very scary, standing at the bedside and watching this disease process as an